Alberta has now lost nearly 2,000 people to COVID-19. In a typical year, that would make it the third leading cause of death, behind cancer and heart disease, but ahead of stroke, accidents, and suicide. The first death was on March 18th, 2020, a man in his 60s from the Edmonton area. And from there, month by month, the death toll grew. Cases subsided over the summer, but came roaring back in the fall. 618 Albertans died in December, the pandemic's deadliest month. More Albertans died in December than in the previous 9 months combined, and the deadliest week came right around Christmas. From December 21st to 27th, the novel coronavirus was claiming 24 lives per day across the province, 1 death every hour. Barbara Wally was among them.
We found it a little unbelievable because Barbara, in many ways, was a very robust, very healthy individual.
Barbara lived with a developmental disability because of a brain injury she suffered during birth. She lived in a small group home in Edmonton. On December 22nd, paramedics were called because Barbara was having trouble breathing. She was admitted to hospital where her sisters were unable to visit. They were finally allowed to see her on December 28th.
We had the respiratory therapist come in and the nurse, and they took her off intubation. And she was gone in 5 minutes.
It's something Alberta's healthcare workers have been dealing with daily for a year now.
It was a lot like Groundhog Day, whereas, every day started with a certain degree of apprehension, and every day finished with the same amount of concerns about what's going into the next day, and then it would repeat. And that was really early on because we didn't know how bad things were going to be. And of course, now that we're hopefully nearing the end, there are so many twists and turns which seem to be pushing that light at the end of the tunnel further back. The beginning was punctuated with a lot more fear and trepidation. As we're into it now, it's really about battling fatigue and trying to keep everybody's game as good as possible so that when we do reach that proverbial finish line, we do it in a way that's strong.
It's been a tough year, full of tough choices. Hospital visitations have been limited, and many Albertans have said their last goodbyes over Skype or FaceTime. Funeral homes, too, have been forced to find new ways to help families grieve, while adhering to public health guidelines to protect both their guests and their staff.
Caring for somebody who's passed away of COVID, this was a new virus. There wasn't a lot of literature on how to protect ourselves. So our first approach was to go over and above and to wear better masks, wear more PPE, make sure that we were protecting ourselves, our staff, and the public. Recently, a friend of mine's mother passed away. One of her sons was not able to visit her in the hospice. It was devastating for him. And so being here to help families, help provide that final viewing opportunity, extending our hours, scheduling for groups of 10 or 20 to come in, scheduling areas for the family to distance themselves so they're not embraced by others, but they can safely be there the entire time. We're trying to help them as best we can.